There are these new treatments that you called ADCs, and I'll explain what that is. These are antibody drug conjugates. So think of it as a little bit of chemotherapy attached to an antibody. The antibody delivers the treatment directly to the tumor. So in some cases, that antibody can also act on the tumor, and in some cases, it's just acting as a delivery truck. So you can think of it as a delivery truck alone or a delivery truck that's also weaponized. For triple-negative breast cancer, most of those antibody drug conjugates are just simple delivery trucks. But there are treatments that seem to be quite effective. For triple-negative breast cancer, there are, at the moment, two that we can use. One is a drug called sacituzumab govitecan. The brand name is Trodelvy, and that's a drug that is very, very commonly used and has shown to be better than other drugs for women who have recurrences of breast cancer. And then the other drug that's used for triple-negative breast cancer, if there's a little bit of HER2 staining in the cancer, is a drug called trastuzumab deruxtecan, or Enhertu. And that, if there has to be a little bit of HER2 staining in the cancer, but that also can be an effective drug. Unfortunately, it's not as magical as we would like. If it were really magical, then it would be so targeted that the patient wouldn't have any side effects. The chemotherapy would go directly to the cancer, and then all of our normal cells wouldn't be affected. But with both of the two drugs I just mentioned, there can be hair loss, there can be nausea, there can be low blood counts, so they can still have many of the side effects that chemotherapy has. Sometimes they're not as bad. I also think that women can look forward to a time when there are going to be a long list of antibody drug conjugates, and we're going to have ever more effective therapy. I think this is a treatment approach that we're going to see used more and more. I have been a breast cancer doctor for many years, for over 30 years, and I'm still a breast cancer doctor, and we use these drugs all the time. I think it's gotten so much attention because it's a new treatment approach and it's an effective treatment approach. And I think we're all hopeful that there are going to be better and better antibody drug conjugates. So remember, there are these two pieces. There's the chemotherapy and there's the antibody. So the better the antibody is, the more it focuses on proteins that are just associated with cancers, the more targeted the treatment will be, and the better the chemotherapy is. And the chemotherapy is often referred to as the payload. So, it's the bullet that's being delivered. And the more effective that is, then it can be even better. So, I think that this is a very exciting field.